Welcome to the PS Dental Podcast, where we discuss dentist stories from their paths to dentistry to their lessons along the way. I'm your host, Ryan McGarvey, the proud son of a dentist. Today, we're thrilled to bring you our first in-person interview with the esteemed Dr. David Gordon, owner of Dr. David Gordon DDS private practice in Austin, Texas. Dr. Gordon is not just a distinguished dentist with an impressive career, he's a passionate advocate for comprehensive dental care, always striving to better his patients' lives. In this episode, we delve into Dr. Gordon's fascinating journey, which began at the University of Texas Health Science Center in San Antonio, followed by a general practice residency at the University of Nebraska Medical Center in Omaha. His commitment to lifelong learning and his deep involvement with the Pankey Institute have shaped a patient-centered approach that emphasizes long-term health and the interconnectedness of every dental procedure. Beyond his professional accolades, Dr. Gordon is a dedicated community member, a mentor, and someone who values the importance of family and personal growth. In our conversation, you'll hear about the pivotal moments that have shaped his career, his thoughts on mentorship, and even some personal insights from his unique upbringing. Also, don't miss out on Dr. Gordon's upcoming online webinar with the Pankey Institute called The Intentional Hygiene Exam, happening on September 5th. It's a free opportunity to gain valuable insights into improving your practice and your hygiene systems, so be sure to tune in. Y'all are going to love this episode. For me, it was exciting to sit down and chat with my friend Dave and share in our love for our strong, independent mothers. Without further ado, here's our interview with Dr. David Gordon. Welcome to the PS Dental Podcast. We are here today with Dr. David Gordon in Austin, Texas. Our first in-person interview. Dr. David Gordon, how are you today, sir?
Ryan, I'm doing great. Thanks for having me. And I know this was a labor of love for your new fiance. So, man, I'm excited. So, we've spent some time together, and I'm excited to be a part of what you're doing.
Yeah, well, I appreciate you stopping by. You've always been, I view you as a mentor to me through my Pankey journey at the Pankey Institute. I've gone to E1 and the symposiums every year. And, having that sit down with you after my E1 experience was very special to me, kind of breaking it down and conceptualizing it a little bit into, something that that can be understood a little bit more. Because, something like E1 means so much to somebody, but you don't really often have the opportunity to actually sit down and break it down with someone who knows it as well as you. So I've appreciated your friendship and your mentorship, and I'm excited to get started with the interview. You ready to go?
Yeah, let's roll.
Cool. All right. So let's get started with family and personal insights. So hometown background. You have quite an interesting background in terms of where you grew up, where you were raised. It's an interesting and diverse upbringing, let's say. Yep. Can you tell us a little bit about your hometown and your family life growing up?
So my mom is born and raised in England, and she met my dad, who was in the military, came over, got stationed there. They met, fell in love and moved to the States. And I have an older brother and older sister who were born in the States. Then my dad got stationed back in Germany. And that's where I was born. Mm-hmm. And my mom, my mom's family was all in England. So we tried to stay in Europe as long as we could. We had a couple of detours from, Japan, stop over in Oklahoma and back to Italy. So until about the 8th grade, we were mostly overseas, and the goal was to be as close to my mom's family as possible.
Right.
But we stationed in an Army base or Air Force base that wasn't on base, so we were always out in the countryside.
Oh, interesting.
And which was great because you got to see the community, and also be a part of the military. So it was cool.
Wow.
So then, 8th grade, we moved to a small country town called China Grove that the Doobie Brothers have a song.
No way.
Yeah. So my assistant, Katie, always, anytime someone asks, where are you from? And I go, and she starts giggling. So my uncle had a farm close to there. Fort Sam was a retirement spot at the time for my dad. And my older brother was a senior in high school. My sister was a freshman or sophomore. And so we that ended up being Texas, ended up being our home state.
Okay. So China Grove is located in the United States. So what age were you when you moved over from Europe to here?
However old you are, between 7th and 8th grade.
7th and 8th grade. So about like 12 to 13 years old. And then you had all of your high school experiences in the United States. How was that transition?
Because where we lived in Europe was always out in the country. Mm-hmm. It was great because we were still out in the country. So it wasn't anything different. I mean, in Italy, it was grapevines. Here, it was cornfields.
Right.
So that was good. That the difference was the music.
Right. Oh.
And some of the obviously culture, but the shortly became a country boy.
No kidding. Yeah. I'm sure a lot of good grassroots country was kind of what you were hearing a good bit out there.
Well, my sister started it because she in Italy got a hold of Barbara Mandrell's "I Was Country When Country Wasn't Cool."
Okay.
And she can tell you she can tell you she was country when country wasn't cool. So she started it.
Man.
But anyway, it was interesting because we'd move every few years, and the people that I became friends with, which were just amazing, had known each other since kindergarten.
Wow.
So, and some of them hadn't been outside of Texas.
Wow.
So it's really, and man, you just couldn't find a better group of people.
How were you able to maintain friendships when you were changing locations so often?
All of us as military kids, we know we move around. I think one of the things that dentistry has is you get to meet people, and you've got to make an impact on them quickly.
Right.
Right. So when you meet a new patient, you've got to build that rapport. Mm-hmm. You're not the new kid in school typically, because everybody is half the kids are
they're all new. They're all brand new. Yeah.
So you learn to just kind of open up and do just be a part of it. So East Central was full of good kids. So so it was a combination of a lot of things. It's not always easy, but there were just good people out there.
Okay, so in terms of, so I don't want to skip from high school to dental school, but there's obviously a gap in there that needs to be filled by when did you decide that you wanted to become a dentist, and what was your path to getting to dental school?
About the 10th grade, I knew I was going to do one of two things, and one of them was something in medicine. Mm-hmm. I like the team aspect. So I also thought about being a fireman.
Wow.
The high school I went to, most of us went to work for the city. Uh-huh. Some of us went to college. And we weren't at the dentist routinely growing up, so there was no big impact. I think the biggest impact in my life, and the biggest, the biggest thing that's consistently reminded me what to do and how to act is my mom. Mm. Growing up in England, she was, healthcare is not the greatest over there. Mm-hmm. Both my mother and father have an 8th grade education.
Wow.
And England, they at a point in time, they decide whether you're going to go to secretary school or university. Mm-hmm. And her parents who adopted her, suggested secretary school. Mm-hmm. So with that, the idea was, well, she didn't have the greatest health, and before the age of 30, she had all of her upper teeth taken out and all of her lower teeth taken out.
Before she was 30?
Yeah.
Wow.
So in high school, I learned that she had a denture, and I never knew.
Oh.
So, I kid with her. She had bad teeth and bad feet. And I hate feet. So, and the other part of that was, I looked at the lifestyle that physicians led. And I wanted to be an ER physician. And we had a guy in school who passed away. And I couldn't imagine telling someone that their kid had just died.
Right.
So I still have a hard time telling someone they're going to lose a tooth. But in the scheme of it, it's still, it was an important part of giving back to my mom. Mm-hmm. It was an important part of doing something that I thought was beneficial to people. And I thought if I could do anything to help her, then that would be a win regardless. But it had the lifestyle and everything else that I thought was cool.
Wow, that's really cool and pretty funny that you teeth and feet. It's kind of a pretty solid rhyme you got there, a little moniker. And also the connection between ER doctor and fireman. It seems like to me the obvious connection is that they're both saving lives in crucial situations. Yeah. Was there? I mean, you mentioned that a guy passed away in high school. Were there any other experiences where you thought, you know what, I want to be in the midst of the chaos. I want to be there to help people.
There was not anything. I'm not a thrill seeker, but as I was talking to you guys earlier about not being able to sit still a lot of times, I think both of those things require you to act on your feet and think and figure things out as they're happening. Mm-hmm. And I enjoy that. When we're working as dentists, and you're working on keeping the patient comfortable. You've got a scenario really almost every different tooth. Mm-hmm. How do I figure this out in the moment with the background and knowledge of knowing what I'm doing and how to get there. So it's a little bit of that. Maybe I don't think there was anything specific in school that said, "Man, this is my passion." But
right.
I do know I really enjoyed being solving things on the spot.
Yeah, like almost like a sense of urgency too.
Yeah.
Keeps you engaged. That's cool. I like that. So moving on to the let's just say dental school experience. Yeah. Can you talk a little bit about your experience attending the University of Texas Health Science Center in San Antonio and how it shaped your academic and professional journey?
Yes, and I'd say the biggest thing is the school at the time was the most. It was in, had deer walking around. There was a lot of grass. Houston and Dallas are in the middle of the city. Mm. So one of the impacts where I was able to stay in a zone that I was comfortable with. Mm-hmm. But really it was the fortune of the people that I was around. My roommate from the last 2 years of college ended up being my roommate in dental school. There's about 9 guys that kind of gelled that freshman year. Mm-hmm. And and I'm sure everybody has that in whatever they do. It was the community drawn to that. And I don't have knowledge of other dental schools or something to speak through, right. But the guys that I was with, when I was, 20 years later, I was the best man of one of them. He was my best man, and that wow. that type of connection. It's still pretty valuable,
right.
And so I can't speak to other schools, but what made that one impressive is. They were on the forefront of doing everything. They had great facilities. And, they were a newer school, so what they provided was, I think, a better vision of dentistry at the time. Mm-hmm. I just didn't know any different.
Right. Well, so you were able to go to this institution, and obviously, it was on the forefront of a lot of different technologies and dental methods. But you were placed in a environment, it seems, that you were comfortable in. You were used to the greenery. Yeah. You were used to almost, I don't want to say a slower pace, but something that wasn't so city-like? And given what you told me about growing up, you grew up in the countryside in Europe and in a small town in Texas. So that makes a lot of sense that you would prefer a pace like that. And obviously it enabled you to be yourself in that environment and create lifelong friends as a result. That's really cool.
And by the time we left there, USA Today voted us #1 dental school.
Wow.
Yeah. And so I'd like to acknowledge I had a lot to do with that.
They said David Gordon went there, and that's enough for us.
That's not true. They rank it on the graduates. So by the time I was a senior, all the people before me had created.
That's good. That's a great thing to inherit, though. That's awesome.
Oh, yeah. #1 school. What'd you do? Well, nothing.
So then you took your talents up to the University of Nebraska Medical Center in Omaha.
Yep.
Why did you choose that location? That seems relatively random from the outside.
So in most of the times where we were in Germany, Italy, England, it was all the more northern, different seasons. And my best friend, or one of my best friends, he ended up being my best man. My wedding, my son Gregory's named after him.
Wow.
He was from Topeka, Kansas. And so, to back up a little bit, part of my world was my dad. My dad was a good man, did everything I think the best that he could, but he abandoned our family when I was in 9th grade. And so I had the fortune of a lot of people stepping into my life. Mm-hmm. Mike Gorham's dad, Gary Scribanik, my roommate in dental school, mm-hmm. His dad and his folks. My freshman year, my family was spread out, and Greg said, "Hey, why don't you come home to Thanksgiving with us?"
Wow.
I'd known the guy for a couple of months. And from that point on, Dean Etz and his dad and Gene Hahn, his uncle, who I ended up living with for a few months, both of them, became mentors and fathers to me. Wow. And so over the years, I'd go home, come back from them, and I just felt like I just left family.
Wow.
So I'd go home and end up going back to Kansas with him, Christmas, spring, some of his buddies, weddings.
Wow.
And so I decided to we were going to move up there. So he did a residency in Kansas, and I did one in Nebraska so mm-hmm. that we could get our feet kind of settled. Mm-hmm. There were three of us. We dropped a guy off in Oklahoma, Greg off in Kansas, and me in Omaha to do our residencies, just to give us, one, get more experience, mm-hmm. but two, I was planning on moving to Kansas, and we were going to open a practice together.
Wow.
Yeah.
So what changed?
We came down for one of our buddy Lance Coleman's wedding, probably the end of April.
Down in Austin?
Yeah. And it was the following year. Played golf. Wedding was beautiful. Went back up 2 weeks later. It snowed for 3 days. And I'm like, yeah. So I packed up, picked up Greg, and drove down. Yeah. It was.
He said, "I can't do this snow thing."
Well, it was, growing up in the North, that's kind of what I thought I was missing.
Yep.
But Texas is, you realize, you realize what you missed, what you had. So he came back.
Yeah.
So he moved back here as well.
Wow. Is he still here?
Unfortunately, about 3 years ago, he passed away from colon cancer.
Wow.
Which was unfortunate. He's got a great son in Ryan and his wife Tammy, who are just the greatest few people that you know. Wow. But it was unfortunate. Something he had battled with some intestinal ulcerative colitis. But to anybody out there, make sure you get your screenings, your colonoscopies. Do what you do, and do it early and often. So
absolutely, yeah. Wow.
But best guy I know.
Wow, yeah. So, what a powerful story. Thank you for sharing that.
Sure.
So when you moved back to Austin, did you found your own practice immediately, or were there, different events along the way?
There are a couple of different events.
Okay.
We had no plan. We just knew we were going to be back in Texas, and we interviewed in a couple of different places: Waco, Dallas, Houston, San Antonio. We knew we didn't. We looked at Austin. His best friend's his parents' best friend, Herb and Liz Brown, moved from Kansas and were here. He was president of NBC Sports at the time.
Cool.
And so we stayed with them. Had a good friend, Holly Munin, show us around. Mm-hmm. And as you know, you spend a little bit of time in Austin. And you're like, yeah,
this could be it. I can stick around here. Yeah.
And so we got an apartment. Didn't have a job. Ended up there was a Dental Centers of America, which were the as I know, the first dental centers in the malls.
Oh, wow.
We're opening up. So I drove down to San Antonio 3 days a week.
Wow.
To work in their San Antonio Windsor Park location, and he opened up Barton Creek Mall location.
Wow.
Because we needed money, and it was a job, and you could go out their front door and watch the big screen during football season.
That's nice.
At Montgomery Wards.
Yeah, that's nice.
When you didn't have patience, and we soon realized that was not what we were meant to do.
It was not sustainable. Yeah.
But it did pay the rent.
Yeah.
So we did that for about 6 months to a year. I was again fortunate to be in a position where the counselor that I had, and they're assigned by alphabet. But the counselor I had named Jack Hartage, a guy named Billy K. Thompson contacted him and said, "You know anybody recently out of dental school that would be open to an associateship?" And I got a call from Billy K. Greg Edson's uncle Gene, who is like a father to me, called and gave him some words that inspired him to call me.
Wow.
And I worked for him, and he was a Pankey trained dentist, and that's how I got introduced. And so there was a couple of paths. Greg ended up buying a practice from another gentleman, and had his own successful practice until he passed away recently. But
right.
I got hooked up with Billy K, and that was I think that was another pivotal point that changed my trajectory.
So you had an associate. You were an associate with Billy K.
Yeah.
For how long?
4.5 years.
Okay.
And the idea was he was gonna retire. I was gonna buy the practice, but until he actually retired, I was only 49% owner. Mm-hmm. So he was still doing it. One of the best dentists I've ever met in my life. Business guy. Yeah, fantastic. And I think he cut down to 3 days, and his wife sent him back after a while. Caught him waxing the floor or something. He was like me.
Yeah,
he just had to be going.
Busy.
And he was good. And he still is. And he's a fantastic guy. But he actually paid for me to go down to E1. At the time, it was C1 through C6. But if I was going to be owner of his practice, I was going to have to do it the Pankey way.
Right.
Yeah.
Wow. So Billy K introduced you to the Pankey Institute.
He sure did. Yeah. So, and I've got the opportunity. Fortunately, I saw him out on the trail a few years back, and I got to stop and walk with him and let him know what that meant to me. And every presentation that you see that I've ever done, Dean Edson's part of it, Gene Hahn, but Billy K's in there too.
Wow.
Yeah, really cool.
I got to know as well. That's a really cool story. I also have to know, did he go by Billy K? Because that's a really catchy name.
Billy K's from Texas, man.
There we go. Okay, good point.
So yeah, it was Billy K, and for me it was BK because but he was just a fine gentleman and a fantastic dentist, good business guy. Got me involved in the both the education of Pankey, but also the local dental societies and stuff like that. So he given back. He was also part of the Travis County rural service, where if you could not afford dentistry, you could apply to the Travis County, and one of the requirements to work there was you had to be a part of that. So
understood.
It's just a giving individual. So,
wow. So far we have 3 individuals who have really touched your life, and we just finished being an associate in your dental career. So now that you've been an associate for 4 years, you've already done your residency, you've graduated dental school. Is this now when you open your own private practice?
I did. And Billy Kay's wife, Wissy.
Yeah.
You like that one?
Wissy K.
She introduced me to my ex-wife.
Wow.
But at the time, she'd only set up 3 people on blind dates, and they'd all gotten married.
Oh, pressure.
So there's no pressure. So anyway, the idea was we were getting married, and it was, hey, are you going to retire? Am I going to buy in? Or what do I do? And it came to where I needed to find a new job or open a practice on my own. And he suggested, he owned a 2-story condominium. He suggested I just go upstairs and open a practice there. And I mean, he was that kind of guy.
Wow.
I had another, we were living downtown, which is 12th and Lamar.
Nice.
Was downtown then.
Yeah. It's pretty north now, right?
Well, it is not
central.
Not
central at all.
It's not the buildings we have now.
Yeah.
So there was another buddy named Mitch Moore who had a practice down on MLK and close to Lamar.
Okay.
And he was moving out, and it was a 2-operatory, 700 square foot, 70-year-old building.
Oh.
Yeah. And which he was moving out of. And so it gave me the opportunity to start my own and started on a way that I'd seen successful. Because Mitch had been again another really good dentist who was more of a you'd think of more of a COIS or an LVI guy. Okay. But just did some great stuff. And I figured if he could do what he was doing there, we thought we could get a start there as well.
Okay. So what year are we talking about?
Probably about 2000, around 2000.
Okay.
Because we opened up May or so, and then that's when the tech boom crashed.
Yeah.
And so it was around that time.
Okay. So now you're in this new location, 70-year-old building, 2 operatories. I'm sure at a certain point you were doing well enough and then you decided that you needed to expand or change locations, right? Because obviously I know that your practice is in a new location now. How did you get to this new central location?
They told us they were tearing the building down.
Didn't give you a choice.
and they put up a high-rise student condominium. They were doing development, and we knew we needed to grow. That was our push. They actually fenced the area and started demolition 2 days after we moved out. We were the last tenants. Yeah, which was kind. They let us stay there until
last possible minute. Yeah.
And we had a guy named Brian who was he's a leasing realtor medical guy, and he was connected with the dental society. He walked into where we are now, which was at the time a newer high rise, right? The new 4-story high rise in Austin.
4-story high rise, yeah.
and walked into a place that was about 2,000 square feet, and it was a furniture store. And he said, "Hey, you know anybody that ever moves out of this building?" Because it was 5 years old and no one had ever moved out. And they go, "Yeah, we're moving."
Wow. At that corner location.
And so Brian just started his stuff and found us a lease, got us negotiated, and we had some just fortunate the consultant I had at the time really also was a lady named Anna Salasporis. Just another fortune of a person that found ways to make your life better. And she said, "Hey, you've got to move." And at the time, there was an architectural group named THE, which all they did was dental offices. And they said, "Hey, we're based in Austin. Yeah, things were getting tight. Henry Schein, everybody else was doing stuff." And they said, we'd like to make an office that is our show office. You want to do it? Unfortunately, that didn't work out. But one of the guys from THE who had been a partner was good friends with Anna. So he said, "Hey, how about we do a project together?" So,
wow.
Brian and Anna Brian, Anna, and construction is what got me. Yeah. So it was good stuff, and it was just the right time.
Yeah. And if anybody is local to Austin, Texas, that's listening to this, the office for David Gordon DDS is right across the street from that wonderful Trader Joe's that everyone loves to go to, and near the Lifetime Athletic. Yeah. And if we're talking early 2000s, obviously there's been a ton of expansion since then and growth in the city in Austin, Texas.
Correct.
How have you been able to adjust to all these different high rises being built up around you? Has that positively affected your practice or negatively affected, or?
We didn't know that was going to happen.
Right.
We had an engineer as a patient named Stan Evans for the city, and he goes, "This place is going to be crazy in about 20 years." And
wow.
Even today, he doesn't. He goes, "I didn't think it was this crazy." Yeah. To answer your question, though, it's been good. Our patients that have come from the buildings and the people around it, and has been good. I mean, it has been a positive impact for us. It has also been a detriment to some of the people who used to just drive up and park on the street and walk in, and that the benefit of the first floor has been beneficial. So it's been good and bad, but overall beneficial, and we've been fortunate again to have a group of patients and a group of team members who have liked the growth and accepted the fact of providing a service like this can be done anywhere, and it's nice that it's kind of like this place. It's just a good vibe. Right.
Yeah. Right. Yeah. And I absolutely agree. And if any of the listeners have been into Dr. Gordon's office, I went for the appointment last year where you gave me the mold for my teeth so I could take it down to Pankey with the articulator and be able to do some work down there, even though I'm not trained at all whatsoever clinically. But that was a nice thing you did. But the thing that struck me the most about your practice on the interior is that, number one, there's lots of pictures of families, of your team members' families in there, which makes it feel very homey. But there's also this feeling that's almost distinctly Texas. I felt. Yeah. Were you the one who was picking out like the specific pieces? Like I think there's a longhorn in there, like a skull. There's lots of different little touches in there that made distinctly Texas. Was that your idea? Was that your vision going in, or did you slowly put that together?
Our vision at the time, and we've been there 18 years. And our vision at the time was to have a place you walked into that was comfortable. And some of the areas are, some of the coffee shops that you walk into that just feel comfortable. That was our vision. When we originally did it, we did have a burnt orange strip going around the entire part. Which,
of course,
which
University of Texas. That's right.
Which was good, but it was in my previous office, I had a hunting picture of a guy shooting quail, and Bethany Meister, who is the design build person behind it, still a good friend. She brought a lot of what you feel there with the warmth and everything else. But she didn't let me bring that picture because
no quail.
She's like, no, I don't know. That's it. Yeah. So it was a good blend of contemporary with a comfort.
Yeah, absolutely.
So, and thank you for saying that.
It is a really cool, distinctly unique practice. And you definitely walk in there. And if you asked someone, you grab an alien from outer space and they somehow have knowledge of, places, they plop you in this dental practice and you ask them where you think it is. Like, they could probably tell you Texas if they knew.
Yeah.
So it's a really cool energy that you put in there. And I can tell that there's a lot of effort put into the little details. So thanks. I wanted to appreciate that. So when opening your practice, were there any unexpected challenges that you came across when you opened your doors?
Finding people to work on.
New patients. Yeah.
We had a lot of availability, which looking back gave us the opportunity to learn and do. Mm-hmm. I was my own hygienist for a long period of time.
Wow. How long?
Probably about 1.5 years.
Wow.
And I hired one of the greatest teammates I've ever had, Trisha Hufford. I got a fantastic team. She worked with me for 20 years. I hired her straight out of school.
Wow.
And I was so thankful. But that time, because I'd carried some of my patients from Billy K's with me. Mm-hmm. And, we had a hygienist there. So I was seeing him, 10 minutes or so every 6 months. Mm-hmm. Man, I got to sit there and just hang out. I mean, we would just sit there and work, clean teeth and have the conversation
Connect.
that hygienists are so fortunate to have. Yeah. And they really are the pillar of that relationship. Right. So right. I got to do that. And the challenges were finding patients.
Yeah.
And paying the bills and eating. But, our place was small and cheap.
Right. Okay. That's amazing to hear that it was cheap, because I look at that location now where it's so central and I'm thinking, man, you must have been sweating it out trying to pay those bills, because it's central downtown now.
Yeah. But it was cheap for a reason.
Right.
Yeah. So it was, it's a testament to, my assistant at the time, Heather Bly, who went on to be a hygienist, and the patients, mm-hmm. Valuing the relationship, over the facility.
Right.
And, there's a couple of patients, Connie and Bill Groskoff, who've just, I've watched their kids grow. It's just, and I remember when we moved to our new office and they went, wow, this is really good. I started to wonder when we were back in MLK, yeah. But it was good. And so the challenges are, finding the right patients, paying the bills, while trying not to sacrifice, what your vision is later. Mm-hmm. Being able to do the things you want to do, mm-hmm. In the way that you want to do them.
Right. Yeah. That's a nice space and opportunity to be able to develop your vision as a young dentist. And obviously making the most of
the time available.
Yeah, the time available. Exactly. Did you do any kind of measures like community outreach or anything beyond building the current patient relationships in order to bring new patients in?
I one of the greatest things that you asked about challenges, but one of the smartest decisions was hiring Anna Salasporus as a consultant. Mm-hmm. She was with a couple of local dentists that had been doing well. They were older, and she just said, "You can do it." And she gave us, we went around doing all kind of handing out flyers, meeting and greeting, trying to connect with physicians, just doing everything you can, and all kinds of stuff that fit within what we wanted to do. Mm-hmm. And our goal was Billy K was a fee for service. Our goal was, can we continue to stay fee for service? do we need to look at adding patients by adding insurance plans? And she exhausted all means of marketing through ourselves, mostly before we kind of went under. So she kept the train going for us.
Right, and you were able to continue to do fee for service, and you never had to go insurance based dental practice.
We tried one time, and we did the numbers, and it was, we signed up with I think it was a Delta, who was the university. We had enough patients that were paying out of pocket already, and again, we only had a handful of patients.
Right.
So we tried for a couple of months, and we didn't see the influx of patients.
Yeah.
And so we stopped.
Okay.
And I'd been during the first year at the dental centers, we'd gone through that and what it looked like. So I knew what to expect. And we just didn't get the influx of patients that made the benefit.
Right.
Which was actually, again, that benefited us. Right?
Yeah. Making the most of a difficult situation.
Yeah.
So as you developed your practice and you grew it, you had new patients coming in, now a healthy practice. As time went on, how has the focus of your practice changed since its formation?
Man, I tell you, I have, I told you I can't sit still, and we're always trying to do something. And I think I've tried just about everything. One of the benefits at when I opened my doors was I was doing a lot of endo at the time. That's actually what I started with Ultradent. Was I was doing some endo lecturing. Billy Kay would refer me patients because I was doing all the endo at his office, and he would send me some of his patients to continue to do endo.
Nice.
I had another friend in town who was busy enough, and endo was just starting to get rotary. It was just starting to get pick up, and so I did a little bit of endo for other people, and they, that's changed over time because now I don't do any.
Right.
While I was there, it really took off with microscopes and everything else, and I realized that at the end of the day, I really sucked at endo.
Dang, that's a tough realization. Dang.
You start to see, and a guy named Dixon McGuire moved to town, came up, and there's another couple, Beasley and Bradford at Northwest Endo, and they came into town about that time, and they were doing the real stuff much faster, much better.
Made you a little more self-aware.
Well, yeah. And I just, and they were good people. So
right.
It's just like, why I don't need to be, my patients deserve better.
Right.
And so,
wow.
We changed. I tried to do more restorative stuff. I still wanted to do everything I can to pay the bills and try stuff. I mean, we tried implants. We tried big case marketing all on fours. When Clear Choice came to town, we were the Clear Choice. We tried all of that, but it was really at the tail end of MLK before we moved. I'd gone to school with in dental school a guy named Kyle Raymond, and he was from a small town called Rockdale. Pedodontist at the time named Scott Franklin was in town, and he was also an orthodontist. He became an orthodontist after that, and he had the vision to see, in our world, if someone has teeth that are crowded, you do certain things. If you have that teeth that have too much space, you just shove them all together. We were seeing joint problems later in life. People's teeth, spreading out later in life. So he really did the forefront of what I saw was really looking at adults and their occlusion, which kind of fit into the whole, philosophy of what I was trying to do.
Right.
And really started an interdisciplinary care process. And Billy Kay had been working with an orthodontist forever. And my time during him, a guy named Jaron Hooten would always send patients over. And actually, he sent me my first patient.
Wow.
Yeah. The Zitos were my actual first patient that I saw, right? But it was from an orthodontist, which was the opposite of what I was taught.
The way typically we go.
And so I was really into ultradent hands-on bonding. One of my classmates, Jamie Morgan, had moved up to Utah, and she was involved in ultradent. And so that was really my foresight to what I changed was I wanted to do something that really relayed back to my mom. You know, how can we keep teeth? How can I not grind on teeth? And how can we put teeth in the right spot rather than grind them down and either take them out or something else? But how can we do that for the long vision of their health? Wow. And Scott had that forefront of you can do a bunch of veneers, or I could put these in the right spot if I just had someone who would actually kind of shape some bonding material on there and add them when they're young, because you can't do that to it. And so we became good friends and both believed in that kind of process. So what's changed over time for a long-winded answer was I really focused on interdisciplinary care, and we and developed a good team with two periodontists, oral surgeon, his partner Tim Brunson and Carrie Lindsay. Just guys who were the periodontist Mike Williamson and Bob Ramirez. They were looking at, okay, I don't want to take this tooth out. What do we do? How does the bite fit into it? And oral surgeon Paul Cosmides is actually the one who did implants on my mom.
Wow.
To help her in her journey, which comes full circle. But it was how do we change people's behavior or our behavior first, so that they could have a better and healthier oral system when they're older. Right? Yeah. And I tell my patients, I said, the less I do to you, the better off you are. Right.
Wow.
So, we had a dentist wife come in, and he's retired, and she said, "Hey, Berkeley wouldn't put veneers on, will you?" And I said, "I'm not going to either, but I've got a great orthodontist in Franklin Brunson that can put them in the right spot."
Yeah.
So anyway, so that's what's changed is I've been able to have a team that both in my office and specialists that believe in the same things that I do, that we can give people better care long term.
From my understanding, the interdisciplinary approach that you have, where you're assembling a team of yourself and specialists to give overall amazing oral health care as a team, I feel that that's rather unusual. Was this something that you had a vision for early on in your career, where you thought, hey, maybe if I pull in other specialists and we team up, that this would be the ideal way to practice dentistry?
Well, Billy Kay started it, and won the Institute. That's something they encourage you to do. Mm-hmm. They're not encouraging you to stop doing specialty work. Mm. They're encouraging you to build a team of people that if we have a case that requires multiple specialists, how can we collaborate to give the patient a better outcome? I think Richard Hunt will tell you it's an attitude of abundance, right? I'm not trying to fight for my patient so I can do an implant on them.
Right. I'm
trying to figure out, okay, what's the best way we can make this person healthy? And a lot of times that's by me not doing a procedure.
That's so interesting. From a business perspective, you would think that you would want to take in as much work as possible, but you've seen practice growth by outsourcing almost.
Well, and your patients want you to do it. Yeah. They trust you.
Right.
The idea though is at least what I've seen. And the idea was Billy Kay had an orthodontist in Jaron Hooten and a periodontist in Dr. Odell, or actually it was Odell's predecessor who was working with him.
Mm-hmm.
He picked up on that because he was a Navy guy and a team player,
mm-hmm.
but he learned it at the Institute.
Okay.
And that is now E4. You're at E1 and going to do case acceptance this upcoming summer, right?
That's right. This week, literally tomorrow.
Oh,
I go tomorrow. Yep.
Well, I'll get you warmed up for the Institute there.
Yeah.
And that's where I saw it.
Mm-hmm.
I really started to understand it the more I hung out with a group of 7 great dentists that we had a mentor in Rich Green that mentored us for over 15 years.
Mm-hmm.
I saw it through them. And then it was my specialist. It was really Scott who believed in me about the bonding. And he's like, hey, everybody else wants to do veneers here.
Mm-hmm.
I was fortunate that, my mom was an artist. I was good with my hands. My dad was a mechanic. So I understood as much as I thought I did
mm-hmm.
at the time to be better. And I wanted to be better at that aspect. And he was at a point where he was like, a need to work with somebody who wants to, not cut it down and do a bunch of veneers, because I want to leave space for these small teeth.
Right.
Collapsing them down is the wrong answer.
Mm-hmm.
And it was the fortune of, this person is missing a tooth. We're going to need a periodontist.
Mm-hmm.
And I'd work with Bob Ramirez early on, and he worked closer with Dr. Mike Williamson. And so, I've always played sports. It's always been, a team mentality.
Uh-huh.
And it was fun. It was fun. We're in our little, our stuff all day. So it was fun to get out and go, what do we want to do with this? Well, if I move the tooth here, can you put an implant here? If I put an implant here, can you put a tooth on it? And so it just kind of naturally developed with the guys that I have, because they had the right values. They understood what to do, and they didn't have ego.
Right.
We can all sit around and Tim Brunson can call me up and go, hey, do you think that turned out as well? Can we do something different? And it was the honesty to go, you're not calling me, crap. You're saying, hey, let's do better.
Huh.
And it was, so it's just,
it's a growth mindset together.
And it was the guys you're around.
Yeah.
So it just finding the right people. It wasn't my idea. I think it's really a Pankey philosophy.
Right.
Yeah.
Right. Well, it's really cool that you were able to implement almost a team mentality to your career, because I think many times when we, enter our careers, not just in dentistry, but in life, we think, okay, how do we go down my lane? How do I get to the place that I want to go? But involving good people in your life as much as you can, I'm sure, has overall helped your satisfaction and happiness, not only giving the best for your patients, but also adding to your own life as well, just being surrounded and interacting more with good guys.
And I will tell you that the real key to that idea was that all of those guys, all of them have tried to help me send them less patients. Meaning they've all tried to help me with placing implants. They've all tried to help me with third molar extractions, with IV sedation. They've all been in my office going, no, here's how you do it. No, you can do this one.
Wow.
You do Invisalign. And with the encouragement of trying to do their job, doing it on my, and at the end of the day, that's the kind of guys they are.
Yeah.
Right.
That's amazing.
Yeah. Anyway, it really is. So at the end of the day, I sucked at all those other stuff. So it didn't really matter because, they were just, they just do it every day and they're better at it. They're perfectionists and all the good stuff.
Such a lack of ego in all of this. Yeah. And I think that's so admirable for all you guys. So moving on to the topic of mentorship, obviously we talked a lot about how mentors, not only in your career, but in your life growing up, have helped shape who you are and your perspective on life. Can you tell me a little bit more about career mentorship? What is the influence that having mentors in your career as a dentist have helped influence you in the path that you were taking? And what advice would you give to people when they're searching for mentors?
Man, that's a good question. And you can go down a list of tons of people. Mm-hmm. I think in career, if I was going to tell you who had the biggest impact, it started with Billy Kay. It went to Rich Green, who, I can't speak publicly without saying the name Mike Rogers. Mm-hmm. I met him at Ultradent, and I believe people are coming into your life for a reason, but I also believe like connecting with you. Mm-hmm. You tend to be drawn to people that are gonna be what you want to be. Mm-hmm. You're an entrepreneur. I've never seen you. Well, I can't say never, because when I'm with you, I feel like you make me better. You know what I mean? Mm-hmm. And so you just get drawn to those people. Mm-hmm. Mike and I met at Ultradent, and out of 150 people, you just draw. You stood up. He got me connected with a group called the ACEs, which were 7 other Pankey dentists or 6 other Pankey dentists that we spent 2 years or 15 years, 2 times a year getting together. Rich Green led that. He taught us how to be a leader, how to do things and think of them differently. Mm-hmm. And then the guys that were in it were just phenomenal at that as well. I would consider all of those guys mentors. Mm-hmm. And then you could just go through you can go through the Pankey faculty and just start ripping them off. Yeah. Kevin Mudge, just keep going. Right. Yeah. Bob Spreen, Jamie Brooks had just phenomenal point. Christine, it just keeps going. Right. And I think the thing I would tell somebody, if you're actually looking for someone to mentor you, mm-hmm. Is to know, again, you start to get to know yourself. I've had some people who just, they're great facilitators and everything else. Fantastic dentist or even people, but just didn't, I couldn't be open enough to take their knowledge. So, over time, I would say in Rich Green stuff, it would be about 2 or 3 years later where I would look back and go,
finally hits you. Finally understand it.
At the time, you realize that, God, Rich, what's he talking about? Mm-hmm. But I knew there was something in me that I wanted to be around him more, mm-hmm. Like everybody does. So when you're looking for a mentor, don't think that when you first connect with them, that's either got to be your mentor or this is the guy. If you spend a few visits with him, mm-hmm. and you realize either I don't feel better inside, mm-hmm. It doesn't mean that he's a bad mentor or you're not a good student. Mm-hmm. It just means it's not the right fit. Right. So I would say look for somebody that makes you better. Mm-hmm. The same outlook of positivity or whatever it is that you are, mm-hmm. and spend a little time with them to and make sure that what they have to give is what you need.
It seems like from what you've said, you also do a lot of almost putting yourself in situations where there is an opportunity to meet someone who could influence your life, because you're so active in so many different groups Would you encourage somebody to do that as well? Just go to as many groups, get as involved as possible within your community, your local dental community, as well as, the national community?
I got to say, if that's your jam, yeah.
Okay.
But if you do not like that stuff, and you're just going to be miserable there.
Wow.
Right. But there are a ton of different ways to meet different facilitators. I mean, if you're at the Institute or you're at a dental meeting, and you find someone that really is kind of goes to a bunch of dental meetings, and you go, well, I'm going to go with them to them, and you just don't like it, that's probably not the right avenue for you.
Right. And that's okay.
That's 100% okay. So you've got to figure out what it is, and if you're searching for a mentor, it doesn't have to be a dentist, right?
Right.
Part of me wanting to give back, I mean, other than my mom, was the fact that I realized, there's a difference between luck and fortune. And, luck is winning the lottery, and fortune is working hard to put yourself in a position. And that may be, volunteering at Habitat for Humanity, you're just packing food or something, right? Rather than, going to a bunch of meetings and being part of the Capital Area Dental Society, where you've got to be involved in a whole bunch of stuff. Right. Just find what works for you, and be open to someone helping you.
Yeah. I love that, because there is a very large component of that that's very non-self-judgmental, in the sense of, okay, if someone that I really admire is going to all these dental meetings and they're clearly thriving and they love it, and I'm going with them and I can't stand it. Yeah. Even though you have an alignment of values and you admire them, it's totally okay that that's just not your jam. Yeah. And understanding what does work for you is extremely important when it comes to putting yourself in an environment that you're comfortable, so that you can be your best self when you're meeting people, because you always want to put the best foot forward, and being selective about the environments you go to, I'm sure, is extremely important in that process.
And not being afraid to try different ones. Right.
Right.
Yeah. So, and from my experience, I'm much different now than I was when I started, but I always liked being around people.
Right.
So
big extrovert.
Yeah. Well, I have to take that back. I like being around people when I can have some control of,
over the environment a little bit. Yeah.
So going to a party where you don't know anybody.
That's tough. Yeah.
Going to a symposium where you know everybody. Hey,
that's easy.
What do you look for? I mean, what would you tell somebody?
In terms of, going out and networking, I think I agree 100% that going to the places that work best for you is what's important. It's really, I'm just going to agree 100% with you that you need to go to places that you can be comfortable. And it comes to an understanding of yourself where, hey, if you're a little bit more on the introverted side and you're somebody that likes to be a wallflower, maybe you find those networking events that are a little more intimate, a little more quiet. They aren't so bustling and so loud, because I think most introverts would be in a place like that and feel tiny, right? Yeah. But you want to go to a place where you can be your full self and be fully comfortable. So when you're introducing yourselves to somebody, it's like, hey man, like if I'm meeting you for the first time, I think most of the time it's awkward for people when they're meeting each other for the first time. It's a little bit clunky. Sometimes it just clicks, but I think that's probably the minority of the time. When you meet somebody and it clicks or you meet somebody and it doesn't click, it's like, as long as you're in a place where you're like, all right, I can take a breath. Yep. I can pace myself. It's okay. Yeah. There's nothing wrong with me. Yeah. Then I think that sets you up in terms of a ideal networking situation. And I think that like what you were saying is that the best mentors in life you have to put yourself in the right position to be open to them. Like most of them will be relatively organic. Like it can't be forced. Like there was, when I was living in Baltimore, there was a guy, an entrepreneur who was doing a lot of media related stuff like photography, videography, which is really similar to what I do. And I was dead set, like this guy, let's call him Tom. Tom is going to be my mentor. Yeah. And I was so awkward when I was trying to talk to this guy because I knew I wanted him to be my mentor. I had just graduated from college. I have no idea what I'm doing with this business when I first started. I'm just trying to figure it out. I knew he could give me advice. And he was a little bit of a cocky guy. Yeah. So I go up to this guy and I literally ask him, I'm like, will you be my mentor? And he's like, what are you talking to me for, kid? Like, it's like, dang, like, all right. Like, I thought that this would be a compliment thing. Like, this is for sure a normal thing. I was at a networking meeting when I did it. And you never forget that because that was a bit of a sting, you know? Yeah. But the mentors you're able to meet more organically, I found is better because it's almost like a friendship where you're getting a lot of value from the mentor, but it automatically and officially designating someone as a mentor kind of gives a, what can I get from you relationship. But I think the reality of any good relationship is that there is an exchange and a mutually beneficial partnership between the two. So that's kind of where I would go with that. So in terms of dentistry, you have mentors, you have people that you learn from. Do you have what you would call an inspiration? Do you have inspirations that you look at and you're like, you may not have a direct connection with them, but do you have people that you look at and you're like, that's the Mount Rushmore. Like, I want to be that.
In dentistry?
Yes. Or life.
My mom. And so I know you have a special connection with your mom. You know, the stories just keep going back to everything she did. And you know, she was 8th grade education. She's from England, but that's still a foreigner. Mm-hmm. You know, it wasn't until I was in college, maybe beginning dental school, that she started studying for her GED. Mm-hmm. And it wasn't until I graduated dental school that she studied and became a United States citizen.
Wow.
She was a lot, you know, and she won't say this, but she, you know, she's just kept learning. All at the same time. Her primary goal was raising her kids. Wow. Self-sacrifice, everything, you know. So I would say if there's any, you know, I've got a fantastic brother and sister who helped so much along the way. But if you know, and in having raised, you know, my own kids, you know, I realized, you know, I realized that's, I think of that on a daily basis of she wants to learn, continue to learn, continue to be there for your kids in an uplifting manner as possible. So, from a dental perspective, I did, you know, there's just a ton of guys that I know through the Institute that and you know, again, it's that you just look at a list of bits and pieces of people that you want to continue the path that they've had. So I could give you a laundry list
for sure.
Yeah. So
you got a great list of mentors. So yeah. I know that you're very appreciative of what people give to your life. Yeah. So we're getting shorter on time. So I'll just ask you a couple more questions. Speaking of continued education, you were obviously a student at the Pankey Institute, among other study groups. When and why did you make the transition to a teaching role? You know, I enjoyed just, you know, my purpose is encouraging others to believe in themselves, that they can change the lives of others. Right. So we tried that and you know, we did all the Rich Green stuff, and I think he was prepping us to be better leaders. And in our morning huddle, I was doing that, and I was spending some time with Mike Rogers, and he just said, "Dude, it's time.
And
Wow.
I can't remember if we were going to a Thunder meeting put on by Jeff Baggett and Mike Fling. And he said, he just said, it's time to give back, dude. And he just looked me in the eye and just, I said, all right. And it was time. So that was, so I'd finished up some things at Pankey and I sat down at E4 with Jim Kincaid and his partner at the time, Bill, and his teaching partner. And they had lunch with me. And I said, guys, I believe I'd like to help the Institute in whichever way I could. And Jim and Bill believed in me and kind of gave me a nudge and talked to Ricky Braswell, who was there at the time. Mm-hmm. And she said, well, why don't you consider that? And then I believe it. So when I got to that point of being, taking a splint course from Buzz Raymond and kind of going through some time with him, I think Mike reached out to Lee Brady and he said, hey, I'd like to consider Dave to be part of the faculty.
Wow.
She reached out to me and I told her my story and Lee, she makes good decisions quickly and
yeah, she does. Very decisive.
She's like, all right, talk to Jackie. And I'm like, whoa.
Hold on a second.
And that was it. But it was Mike looking at me in the eye and going, hey, it's time you start giving back.
Wow. How did that make you feel when you were told, hey, it's time to start giving back? You're doing a lot of learning. Let's give something.
He and I had talked for 20 years about trying to do something together.
20 years.
Yeah. Well, that's not long. It was probably 5, but it
probably felt like 20.
Yeah. And he said, well, I said, well, what's the, what do you think we ought to do? He said, well, he said, the first part is, you get onto the, let's see if you can give back to the Institute because it's given you so much. And so he and I had always wanted to do something together. We just get along, right? It's just, if you talk about a guy who makes me better, that guy does.
Wow.
So that was it. So I started on 2020 and being a faculty assistant and went through all the E's again as an assistant and started doing E3 as a faculty member a couple of years ago, and it's been more rewarding and more beneficial than I ever thought it could be.
What have you learned from teaching?
That there's a lot I don't know.
Yeah.
Because it's one thing to say you do it. Mm-hmm. It's another thing to have to show someone to do it, and then it's another thing to have to show someone what you did. Mm-hmm. So there are steps that you think you do that you believe was good, and then you've got to take pictures and show it to other people, and then you've got to explain it. Mm-hmm. So you make it simple and give them explain. I think I think the other thing that Mike did was he believed in me more than I believed in myself.
Wow.
And he said, I said, I don't, what do I have to give? He goes, I think the biggest thing, if I want to nail it down here in the short time we have, for anyone, whether it's you're teaching, you're talking to your patient, you're working with your team, your kids, is that everyone has a story to tell. And that story is important, and it's important to them.
Wow.
And if it's important enough to them, it's probably important enough to someone else.
Wow.
So
that is so empowering.
Well, it's a lot of, I'm just paraphrasing a lot of other people.
Right. I mean, that's where we learn, and that's where we grow, is through other good people. And I mean, that is such an empowering thing, even for me to hear as someone who's like starting a podcast, is why would I start a podcast, right? Like, what do I have? But really what that says is everyone has their own story and their own perspective. And, it's always possible that maybe it's your perspective that somehow gets through to somebody.
And I I know we're a little short on time, but I got to ask you. So what's the impact? Because we both have fantastic mothers. What's the impact your mom has had on you and where you are right now?
I mean, I don't even know where to begin.
Well, I ask you that because I in the walk we had around after E1, or even our first meeting, it was, you've had some challenges. And I know this isn't about you, but the challenges seem to kept resonating with the support you grew up with.
Right.
So I hope it's okay that I asked you
Absolutely. Because that's obviously something that we relate to each other very well, is independent, strong, loving mothers.
Yep.
Obviously, my mom is the reason why I founded Proud Son Dental Marketing. I mean, how much more proud does it get than that, right? Like that's a heck of a move I did. Yeah. But my mom has always been, to me, someone who has been as determined and driven and articulate as one could imagine, like so competent in everything she ever set her mind to. But she was always, for me, the listening ear that I needed growing up.
Wow.
So that combination of just intelligence and strength, along with nurturing and comforting, everything that I am is trying to be more like her.
Cool.
And there's a reason why I started, I'm very good at understanding the digital landscape and marketing. That's my strength. That's why I'm trying to partner with my mom and people like my mom, because similar to you, I like to surround myself with good people. And it's very rewarding for me because I know the work that she did on a daily basis truly changed lives.
Yeah.
And just an opportunity to have a piece of something like that where, the sciences and dentistry wasn't my strength to do, but how can I help someone else do that?
Cool.
So it shapes my everyday. My mom has given me everything. Everything. Yeah. It's pretty great. Yeah. It's pretty amazing having a strong mother like that. And gratitude is always so important. I think giving gratitude to people, and you're obviously extremely open about your gratitude for people. Giving gratitude to people before death, I feel like it's such an underrated thing for people. Like, say thank you and let people know how much they mean to you right now. Like we have a tradition where every 5 years in my family, we get, so I grew up at a Jesuit all boys high school, and we had this thing called Kairos, where you go on this retreat for 3 days, and going into it, you have no idea what's going to happen during the retreat. It's this big mystery. And then you enter junior year, and then you have to go on Kairos. And you were given an opportunity to write thank you letters to the other guys on the retreat that you had been given an opportunity to be grateful for. Yeah. And that was, in terms of an exercise that changed my life, nothing in comparison has ever changed my life the way that did, because not only was I able to give gratitude, and we're a bunch of boys, right? So we're always competitive. We're always ribbing each other and stuff and being competitive with each other. So when you're given a chance to be sentimental and meaningful, in that environment, it's like, if you can do it in that environment, it can have that big of an impact on you, then that's something you need to carry for the rest of your life. So I'm constantly, every single phone call with my mom, I love you. Thank you so much for everything. Absolutely. Always, as long as they're here. And you never know, because life is short, when things can change in our lives. But I just feel very strongly about gratitude and being as grateful as possible to the people around you on a daily basis.
Thanks for letting me ask you that question.
No, I appreciate you asking. So a couple more topics left. Personal life, family.
Yep.
You're very passionate about your family. Obviously, we were just talking about it right before the interview. You're very passionate in particular about the relationship with your kids.
Yep.
How do you handle the ever developing role of fatherhood?
I think I learned a lot from my kids.
Mm-hmm.
How do I handle it? Well, as someone once said, hold on. And, really, I'm fortunate to have kids that have wanted to spend the time with me. That we have spent. I've raised them by myself since the last 5 or 6 years. And my daughter will say she raised Gregory and I. So the role of what's changed, I think, or is just being a little slower, and wanting to hear what they have to say. And the idea that you're still the person they look for guidance, while extending that opportunity for them to grow and make mistakes and learn. And I think is being open to them teaching you stuff, right? And I think at times they're also letting me grow and make mistakes without stopping me, right? They're like, all right, that's gonna work, but
I don't know, Dad, but go try it.
That ain't gonna work, but let it try, that kind of thing. And I think they're, again, they've surrounded themselves with some good people and some good friends, and we, I had a village. I've got 4 really good friends within a mile, and our neighbors, and good friends that are in the neighborhood that helped that. And so the idea is the role has been, I'm not their friend, I'm their parent. But I also understand sometimes they understand stuff better than I do, right?
Interesting. And
that if I'm willing to let them grow, be open to letting them help me grow.
Wow.
Yeah, that's it.
That's such a humble approach to fatherhood, because of course, I'm not a father yet. I will be, someday.
You're going to be good.
I'm going to try my best.
Yeah.
But that's such a humble way to enter it, because obviously you've lived more life, so you feel like you should know everything. But the reality is that we're all going through life for the first time together. So we're all navigating the same thing. So I think that's a really beautiful way to enter fatherhood.
Yeah.
So exercise.
Yes.
You're in fantastic shape.
Oh, thanks.
Can you?
As well you.
But
let's have a compliment off.
Okay.
Well, if I look like you, you got slim.
You got the definition. So in terms of, can you discuss a little bit how you implement a consistent exercise routine into your life? You run a lot, right?
So I do a couple of things. I run. I'm trying something different called rucking.
Rucking. What is that?
It's kind of a fast walk or a shuffle with a weighted backpack.
Oh,
yeah. So
probably good for the core.
Supposedly good for core and posture, and as you start to battle running injuries over years, maybe a little less on the knees and stuff like that.
Okay. Yeah.
But yeah, I worked out with a group of guys 2 or 3 times a week for about 10 years.
Wow.
I say, again, I seem to be, attracted to team stuff. Yeah. And there was about 8 or 9 of us for a while, and it kind of dwindled as people got married and had kids. But we would work out with the trainer, and we switched gyms to whatever he was at. But I had the fortune of being a dentist. You can kind of set some hours and stuff on your own.
Mm-hmm.
My kids also were swimmers.
Mm-hmm.
And the benefit of that is the coaches do not want you at practice. like football, in Texas, you go to football and a lot of parents would be out on, watching the practice and stuff like that.
Yeah.
They don't want you there.
Get out of here, Dad.
Yeah. There's not room. It's a pool. Right.
Uh-huh.
And so, if the kids were at practice and I'd got to go back in an hour, I could spend 20, 30 minutes driving them out there, 20, 30 minutes driving back, do something for 20, 30 minutes. And so I just started running or exercising while they were at practice, because it was either that or sit in my car.
Right.
Yeah. And their mom would take them and if they're both at practice, then I would try to do some exercise.
Right.
That's, that was the easiest way. And it was just part of your life. And if you're sitting doing this all day, every day, you got to do something else. And, we had weights in the garage. We did P90X. We've done it all. Pushed kids in stroller, joggers, again, it was something you had to, after staring at small stuff all day, I just had to get out and burn some mind stuff. And,
right.
And when you're out, and I liked running, because when you're out running, there's no one can ask you questions or anything else.
Right.
So, what do you do?
I do a lot of weightlifting, and I play a lot of sand volleyball. Yeah. So sand volleyball is really my cardio. For me, exercise, I need some kind of competitive element in order to keep me engaged. And if I can, I'm at an age where a lot of my peers are unmarried, so everyone can just pick up and play volleyball on a weekday. Yeah. So for me, fortunately, that's what it is right now. I try to find variety. It seems like you found a lot of variety
and that won't change at all when you get married.
Is that right? Yeah. That's the best way for me to get exercise, is through that competitive element and weightlifting. I've always, my dad used to weightlift in our basement. Yeah. We had really a pretty good gym in the basement with, dumbbells and stuff. And, my brother and I would be watching TV in the basement, and you'd hear my dad grunting in the background because he's just pumping weights. So we had that influence from very, very early on. And my mom started getting into weightlifting. So weightlifting is really my bread and butter. Yeah. We go to the Equinox on South Congress, which we've really enjoyed. And then we just moved into a nice apartment complex with a really nice gym there too. So I found accessibility and consistency is the key whenever I'm the best in shape. Similar to what you were saying, it's just really finding the right slot to be able to do it on a daily basis, because it's a lifestyle more than anything. Final topic. Okay. You have an upcoming webinar on September 5th through the Pankey Institute, titled "The Intentional Hygiene Exam."
Yes.
Tell us a little bit about the webinar, and what can a student expect to learn by tuning in?
The webinar is done by Mike Rogers and myself. It is geared around something that we all do on a daily basis, and he tells a story, and he tells a story about a hygiene exam that just didn't feel good to him. And a few years ago, we talked and we said, how can we make an impact? You told me it was time to start giving back. How can we really do that? And we thought, well, can we come up with some simple steps to make people have a better day? And what is it that technically people have struggled with? Well, we're not going to teach someone how to do implants, but what is it that we can help with? What do you struggle with on a daily basis that is just, and it was, and he had his hygiene exam, and it was something that he said, hey, is there a way we can do this better? Make a bigger impact on our patients' lives? Is there something that our hygienist and our team could feel like they were having a bigger impact rather than just scraping plaque and convincing people to floss? Mm-hmm. So we came up with what we thought were 6 simple steps for an intentional hygiene exam, meaning something that you could follow that would allow you to be present with the patient, have your hygienist get involved from a behavioral standpoint, and bring them into it more as a healthcare provider rather than just the person who just cleaned the person's teeth and told you, how much tartar was going on or something like that.
Right.
And that approach to us seemed to make sense. And we tried to put it in a 6 simple steps of a system that that developed a hygiene program. But the key is if you've got to do it anyway, have some fun and be intentional with it.
Right.
And if it makes your patient better, and it gives the hygienist some more value to feel like they're making a difference, and you could do it in a way that was straightforward.
Right.
We put that together, and our webinars is hopefully what you'll learn is a few simple things that can make your hygiene exam more impactful.
That's amazing.
Yeah, we'll see.
All right. September 5th is the date.
7:00.
7:00 p.m. Central Time?
Central Time.
And it's on the Pankey Institute website where they can register?
That is correct. And it's free.
Oh, how could you not?
Well, and the system that you learn, it's free.
So what do you have to lose? And you get a CE credit as well? Correct. Beautiful.
Yeah.
All right.
And thanks for letting me talk about that. It's
my pleasure.
We really feel good about it.
Well, I will be tuning in myself, so I got to plug it. So that's it. Thank you so much for joining us, Dr. Dave Gordon. Really a pleasure to talk to you as always.
Thank you
for sitting down with us.
Yeah. Hey, thanks for having me.
Can't wait to talk to you again soon.
Perfect.